Today I'm going to talk about my project, which right now I'm calling COVID-19 Navigation Practices, how people seek information and accomplish tasks during an extended crisis. Why is this not working? Oh, there we go. All right, I guess just click on it. Okay, so since the theme of our fellowship is resilience, I wanted to mention my own attempts at resilience during the pandemic, and just mention that this project is not the project that I originally had planned to be working on right now. I was planning to study how individuals and frontline multi-sector providers navigate the behavioral health service system in Maricopa County. But that project required face-to-face interviews and observations, which is not feasible during the pandemic or safe for me or my students. So it's currently on hold, although will definitely come back to it. And when it became clear that COVID-19 was going to require drastic changes in research methodologies, I began a new COVID-19 focus project. So the problem, the COVID-19 pandemic has imposed unprecedented social challenges as countries across the globe have issued lockdown and shelter-in-place orders, leading to sudden and massive breakdowns in the socio-technical assemblages on which people rely for food, shelter, work, education, childcare, healthcare, socialization, and more. So these are just a few photos. This is a Creative Commons license photo up here from a family who's visiting an elderly relative in a nursing home and like talking to her through glass using a phone. And then in the bottom right corner, I've been saving screenshots of news articles, and this one just, I was like, this is a sign of the times. When there are arrests over toilet paper. And then this photo is from a recent visit I had to a doctor's office. And I thought it was notable both for like the ways that they are keeping people distant and also for the emptiness of the waiting room. And I was the only person there at the doctor. So, you know, we're seeing this like just sort of huge impact on businesses and business as usual. And so in sociological terms, Anthony Giddens would talk about that as a breakdown in ontological security, or the ongoing sense of sort of rightness and comfort in the world that comes from semi-stable orderings of activity and meaning. So past work on navigation describes navigation as the labor-intensive work that individuals must do to form the nexus that connects multiple disconnected service providers, organizations, and information sources together and creates a functioning microservice system. So when we talk about service systems, especially in the US, where we tend to have a lot of very fragmented systems and organizations and information resources, the word system is really a misnomer. We have like a bunch of disconnected elements that people have to, through their own hard labor and situated work, have to sew together and, you know, keep going on an ongoing basis through their situated practices. Individuals have to adapt to an ever-changing landscape of elements, meaning that these patched together systems are under constant threat of collapse, upon which the service landscape must be relearned and the microservice system stitched back together. So despite being largely unrecognized and invisible to like the academic literature, so like the organization science literature, for example, information science and other literatures that look at such things, you know, they don't look at these kinds of practices. So navigation requires extensive time and effort and bears significant material, social, and emotional burdens for consumers of services. So in the healthcare domain, where I've been looking at these issues, navigation requires constant and complex navigate. So I use the word twice, but so this involves constant and complex navigation of administrative barriers, which contributes to excessive treatment burden on patients. So just some related work on navigation. There's been an interesting like uptick in the past decade in this role for professional patient navigators. And they've become really common in cancer care and some other specialties, and have really pointed to some of the problems and difficulties with navigation and the need to support people as they navigate these complex administrative systems and fragmented organizations. But these rules are often not available. And the range of work that people do is usually a lot wider than that's done by a professional patient navigator. And interestingly, in prior work, we found that navigation is required in many arenas, not just in healthcare. So for example, people who are trying to navigate the immigration system or other kinds of social service systems are also doing navigation work. Although, these professional navigator roles only really exist in healthcare right now that we found. So past research on navigation practices looks at the social and technical or socio-technical practices through which an individual traverses a metaphorical landscape of elements, interacting with a variety of touch points in the process of acquiring resources. So for example, a particular piece of information or a particular connection, or accomplishing needed tasks. So this work on navigation practices combines and extends some other streams of research on information landscapes, coordination, literacy, so for example, health literacy, digital literacy, numeracy, and by examining how people seek resources, including information, and applying them to accomplish tasks. So not just looking at how people get information and apply it, but also how they're actually applying, how they're accomplishing tasks amidst real world constraints and situated contexts. Okay, so that brings me to my questions. So the questions here are, what navigation practices are people using to acquire information and make decisions and accomplish tasks during the COVID-19 pandemic? And how are individuals with different risks navigating to meet their specific needs? So the methods that I'm using are interpretive research methods. I'm using semi-structured interviews. So by interpretive research methods, I don't have a hypothesis that I'm testing. Essentially, the theory arises from the data, not the other way around. I'm not testing a theory, I'm building theory. So I am using semi-structured interviews conducted by phone and Zoom. And we've conducted 35 interviews so far. Ranging in length from 50 to 90 minutes. The average is about 70 minutes. And I'm using criterion sampling, which basically means that we are looking for participants who have particular characteristics. And so we have one group of people who have no particular risk factors, and another group of people who have some specific risk factors for difficulty with navigation. So those who are immunocompromised, they're self-identified as immunocompromised, they've lost a job due to COVID-19, or they are essential workers. We've been recruiting interview participants via personal networks, social media, and various listservs. Participants live across the US, and they're being compensated with a $20 Amazon gift card, a digital gift card, so we don't have to send anything physical. So I'm just sort of like swimming in data right now and still collecting data. So I haven't quite gotten to the so what yet. I think it'll just take a little time. And we have some different emerging themes. But I wanted to discuss this one emerging theme that I think will move towards sort of a so what and a contribution. So one of the things that's really coming out of the interviews is that people are really navigating risk. And that's a key part of navigation during the COVID-19 pandemic. So people are working to develop both like a global understanding of risk, of like, what is COVID-19, what are the risks to the populace? But then they have to like translate all of that into their own situated assessment of personal risk. So like, given my living situation, who I live with, where I live, what I touch, what I do in a day, like what's my own risk? And what are the activities that I engage in, like opening me up to and exposing me to in terms of risk? And the people are also engaging in relational assessments of risk. So like, they're not just thinking about their own risk, but they're thinking about like the risk of the people that they come into contact with. So like, people are acting differently. They're navigating life differently. Like if they live with somebody who is immunocompromised, or even in some cases, like if they have a neighbor that they're trying to help out who's immunocompromised, or like a elderly parent, So they're thinking about risk in terms of not just like what they might be exposed to in their risk, but also who they might bring risk to. And I need to like look more at the risk literature. This is all just sort of coming out of the data right now. And then one of the elements of navigation is balancing the risk of essential tasks with the risks of COVID-19. So we're talking with people about how they're navigating like work, education of children, getting essential goods, social contact, and healthcare services, and finances. And so one of the things that a number of participants, for example, have had to do is people are reporting that they've had a boss that sees their work as essential, whether or not it's actually classified as essential, and like wants people to come in to work. And so people have had to weigh the risk of like arguing with their boss about letting them work from home. And like that, because that imposes potential social and financial risks of angering a boss at a time when like work is precarious for a lot of people, with the risk of being exposed to COVID at the office. And people are also, they're weighing like the risk of taking public transit. So for example, we had a participant who is food insecure, and she usually uses her EBT at the farmer's market because she gets more food and better quality food, but she feels that the risk of riding public transit is too high. So she has a Walmart that is a 45-minute walk from her, and so she's developed this routine of like walking to the Walmart because she's made that risk assessment. But people are really unsure about these risk assessments. So like which one is better? So another thing that's coming out is like the vast majority of people that we've talked with are delaying non-COVID-19 healthcare treatment. Some of them for really major things, like for example, one participant is delaying a knee replacement surgery that he feels he really, really needs, and is instead like walking very slowly multiple miles a day because he thinks that will keep the muscles that he has strong. And another person paused hormone replacement therapy, a transgender individual, and is now suffering pretty severe anxiety because of it. And so, people are really making these difficult determinations about, and I think that's something that we're going to see down the line, are like the effects of the healthcare that wasn't done because of COVID. So we're finding that navigation is really guided by these situated risk assessments. So for example, people are trying to think about their risk in advance. Like one participant she's in a financial position to be lucky enough to be able to do this, but she's able to move some money around to pay off her mortgage because she was worried about her family's financial situation going forward and didn't want to have to pay a mortgage. And I think that they were pretty late in their mortgage, but so authoritative information sources. So people are working really hard to seek information, but the authoritative sources fall really far short in providing helpful guidance about situated risk. So when people even when they're looking at authoritative sources like the CDC, they're like, okay, well, what does physical distancing mean if I live in a cul-de-sac and I have little kids and my little kids are going nuts inside? Can I physical distance with the family next door? Can I take public transit? Do I need to wipe things down? Like people are really unsure about what's okay and what's not okay because the official guidance is it's kind of broad. It doesn't really apply to people's local contexts and situations. And so another thing that we're finding is that people are looking to knowledgeable members of their personal network to act as, like, we're calling it human filters for risk information. So people who are kind of reading everything and who are able to help people figure out like what's okay and what's not okay for them. Or they're serving as human filters. And some of the people that we've talked to are putting a ton of time into like sending group texts to friends and talking friends through different elements of their daily lives and things like that. So just some things that we're seeing in the data so far, but we haven't done a full analysis yet. So in fact, we barely started the analysis. So deliverables will be journal articles. So I'll begin writing this summer. Dissemination of work in media, something that I've I'm hoping to accomplish. And I've already done that, and also working on some grant proposals. And I'm working on some international collaboration on this so that we can understand how navigation varies across international contexts. So I'm working with a colleague in the UK and then Denmark and in Australia. He's doing work in the Philippines and Australia, New Zealand, and a colleague in Brazil. And then one thing I really want to focus on going forward as a deliverable too is thinking about how navigation practices can illuminate resilience of systems. So connecting to the themes of the fellowship, and like I know I had planned to look at more system level, and now I'm looking at these very individual things, but I think that there's something interesting about navigation practices that can really help us to see, you know, elements of resilience in systems. So, and then also from the original project, fortunately, we're still able to move this along, and Dawn has really been pushing this forward, which has been awesome. And I'm working on this with her to develop this Maricopa County map of behavioral health services. So we're hoping to be able to move that along, and with Dawn's leadership, and really, and I'm hoping that we can get something published from that, which would be great, and continue that work. So still set up to do this original work. So these are works cited and my acknowledgements. This is
great.
I don't know, I always like these human towers.
That's a great visual on that. Yeah. Thank you so much, Katie. Fabulous. That's really fascinating. Can we get some questions in the chat? Or just speak out loud.
Katie, I really like what you're doing. I was trying to figure out, I'm really interested in the idea of navigating and how that, like how to navigate times of turbulence. I think that it's an important question. And I was wondering, in terms of the, so what, I was trying to think of, you know, like, would you be able to, and I feel like you're doing that somewhat, like you have like different groups, and so like you might be able to tie that back to how social factors determine the ability to navigate. And so like, you know, like it might just not be like just characterizing the response, but like then saying, well, none of those happened in a vacuum. All of those are tied to, there's reasons why people choose to do this, or they can delay that. And I think that that's an interesting sort of part of the equation.
Yeah, I think that's a really good point. And I think, so in this initial round of data collection, we didn't sample in a way, like you do these risk groups, but I actually am submitting like an LOI for a grant proposal today that would extend this and really look at people from specific ethnic minorities that are impacted by COVID at a higher rate, and then people who have low income, and looking at more specific, you know, which I think would be helpful in terms of like actually looking at how those social factors impact, not really like navigation practices so much as navigation barriers, maybe.
Yeah. Okay, perhaps we can talk, like, because like I'm trying to submit something with Mike Schoen around like how people react and like how socioeconomic factors determine their reaction. So because like you can, and then like you can actually find this sort of thresholds. Is like below this sort of amount of money, people are going to have to break quarantine, right? So in the next pandemic, do not give a stimulus to everybody. Go for those people that are really at the breaking point of behavior change, right? Like people who can, you know, like who are going to be unsafe because they have no other options. So anyways, like this is another idea, but maybe at some point we could connect.
I would love to. That sounds like, that's really cool. I didn't know that work existed. That's awesome.
It doesn't. We're dreaming.
Yeah, that sounds really, really interesting. Because I haven't really known how to approach that.
Julia is asking a really interesting question, and that popped in my mind too. Julia, you want to take that?
Yeah, sure. I'm not really sure it's a question as much as just listening to Katie and the things that you're saying about maybe looking into the different socioeconomic factors. And, you know, the Navajo Nation right now is having, it's just such a huge problem. And I'm sure in other rural areas as well, but with them specifically, because there's the different cultural factors and, you know, socioeconomic factors and rural factors. And I wonder how people are managing to navigate the healthcare system in that setting, and what practices there are that already exist, and kind of where the gaps are there for navigation.
Yeah, I've actually been looking at Navajo Nation some, and if you have more resources, like, and that I put that in the LOI I just wrote. I know that they're having a huge impact, and I know there are some tribes in the Northwest that have actually like blocked off roads, like they're just saying like nobody can come in, and are, because they've been, you know, they're so worried about spread.
And the Navajo Nation has even, I think it's even more interesting because it spans what, 3 or 4 states?
Yeah, it's like Arizona, New Mexico, and Colorado, I think. Is that right? Or Utah?
Or Utah. I think Utah maybe.